Good afternoon to everybody who's joining this webinar. It's the very first webinar of the EAHAD Psychosocial Committee, and the purpose is for you to get to know us. My name is Christina Burgess. I am the chair of the Psychosocial Committee, and I will shortly be asking all of my wonderful colleagues in the committee to introduce themselves. And I will also, before they introduce themselves, tell you a little bit about myself. But first of all, we would like to pay tribute to a very close colleague of ours who up until recently was with us on the committee, Dr. Ana Torres Ortuño from Spain. She very sadly passed away a few weeks ago. She was a founding member of the Psychosocial, as it was then, working group with Dr. Lotte Haverman, and she played a key role in contributing to our work, into promoting the network, and to ensuring, along with all of my colleagues, that our work enabled us to become a committee out of the working group that we were for the first 3 years. So please just take a moment to remember our very lovely colleague, Ana Torres Ortuño, and we miss her very, very much. So, as I mentioned, I'm Christina Burgess. I'm director of a charity called Haemophilia and Bleeding Disorders Counselling Association. I've been on the Psychosocial Working Group and Committee almost from its inception as well, and working very hard to support the bleeding disorder community in the United Kingdom, and also to support the work we're doing across Europe. So I'm going to leave it to my colleagues. We'll start with Karolien from Belgium.
Hi, everybody. So I'm Karolien. I work in the University Hospitals Leuven in Belgium. I work with people with hemophilia and other bleeding disorders since 2014, I think. And I'm in the committee since 1 year now, I think. Yeah. And I work with both adults and children. So that's, yeah, a little part of my job. The other big part of my job here in the hospital is to coordinate the 460 volunteers here. So I do two jobs here in Leuven. Thank you.
Thank you. And then we'll go to Petra.
Hello, my name is Petra Bučková. I work as a clinical psychologist in University Hospital Brno in the Czech Republic, and I've been a member of Comprehensive Care Center for patients with hemophilia since for 12 years. And I've been a member of psychosocial committees almost since the beginning, from the beginning. And here in my country, I take care of patients with hemophilia and from in a hospital, I in daily care, and I also cooperate with patient organizations for children, Hemo Junior, and for adults, Czech Union for patients with hemophilia, where I provide counseling, education, and group therapy and counseling. Thank you, and please continue, Lotte.
Thank you. So, yes, actually, we'll go to Gaby next, who is our colleague from Israel.
Hello, my name is Gaby Golan. I'm clinical and medical psychologist. Started to work in the Hemophilia Center at 1998. And I'm part of this committee, I think 6 years or something like this. That's all.
Thank you, Gaby. And then to Lotte.
Hello, my name is Lotte Haverman. I'm a pediatric psychologist by training, working in the Emma Children's Hospital in Amsterdam and part of the Hemophilia Center in the multidisciplinary team as a psychologist, but I'm mainly focusing on research a lot of psychosocial research concerning hemophilia and bleeding disorders on children and adults.
Thank you, Lotte. And then to Gráinne.
Hello, my name is Gráinne O'Brien. I'm a clinical psychologist based in Edinburgh, working with children and adults with inherited bleeding disorders across Scotland. And I have been with the EAHAD Psychosocial Committee for just over a year, similar to Karolien, and I'm excited, hopefully, for more people to join us at our events.
Thank you, Gráinne. And then to Gloria. Gloria is a social worker from Ireland, and we're very lucky to have two social workers, Gloria and Karolien, as part of our committee, and we are very good at collaborating together. Unfortunately, it seems that Gloria is not with us right now, but hopefully she will join us shortly. So we'll carry on now with the webinar, and perhaps, Giuliana, you can show us the slides. So I'd like to introduce Lotte, who you've just heard from, and she's going to talk to you about the European Psychosocial Roundtable and the creation of European principles of psychology in novel therapies. Lotte, please.
Yes, so I first will go through the history of our committee. I'm the former chair, so I will tell you a little bit more where we started. So our first meeting was in 2016 during one of the EAHAD meetings, and we start thinking about like getting together as psychosocial professionals around bleeding disorders and hemophilia. And we started as a working group. And in 2021, we managed to become an official committee of the EAHAD. And as you see, we are like around 20 people during the meetings. And one of the reasons we want to introduce ourselves is exactly as Gráinne said, to invite you to be part of us and to get to know you as well. So one of the few things we did was, of course, creating goals for the future and to be very specific about our work and what does it mean to have psychosocial professionals around bleeding disorders. But we also managed to publish 2 papers from our working group. There was the impact of COVID from a psychosocial perspective. And we did a survey about psychosocial care throughout Europe in the treatment centers. And last year on the EAHAD Congress, we did a roundtable on psychosocial aspects around new therapies. And the idea was to improve psychosocial care and to be more clear about what services are needed and what is comprehensive care and psychosocial needs, and to create standards. And we were not reinventing the wheel because I think Gráinne and Christina were involved in the UK version. And we thought it was a very good idea. So we stole that idea. I did it together with Christina, so I think it was fine. But we did it again. And that's what we did. And we started our meeting there with what is patient-centered care. It's about seeing the patient in the middle or part of the multidisciplinary team, just to listen, to set goals, to be alert on mental health, to also incorporate the patient's surroundings, like partners, children, parents, and to provide options of treatments, but all together with and for the patient. And if we talk about psychosocial care or psychosocial services, it's maybe all about good mental health and high quality of life. And if you talk with doctors about what's quality of life, influencing quality of life, they like to think that's about like clinical encounters which are influencing quality of life, such as values in the blood or measurements from CT or cardio. But as psychosocial professionals, we know that it's often more related to other outcomes, such as pain, fatigue, or feeling depressed. That's part of outcomes that are only able to be reported by the patients themselves. So we need to ask how they are feeling and what's important to them to improve quality of life. And we only can have an idea of the quality of life of people if we ask them by interviewing them or with conducting focus groups. And one way to collect this information in a more standardized way is with patient-reported outcome measures. And these are all meant to create a more patient-centered care in the beginning and in the perspective of new therapies. So if you know what outcomes are important in new therapies or for patients, you also know what to measure and how to measure, what questionnaires to use. And so I think that the first thing that is in new therapies most profoundly look at are the clinical outcomes. But I think it's also from a psychosocial perspective so important to collect patient-reported outcomes and to add the right questionnaires in hemophilia treatment. And I think this is something that's still challenging, as a lot of quality of life questionnaires in hemophilia care or used for people with bleeding disorders are lacking psychometric properties. So we cannot detect the influence of new treatments. And this is why we are also starting with trying to harmonize, standardize patient-reported outcomes. But then we need to know what is important in new treatments for patients. What are important outcomes? And if you're talking about new therapies and gene therapy, this is we wanted to show you a video, but it's even better if you look at home on YouTube, and it's from Luke Pembroke. And I think we share the YouTube in the chat, but it's very interesting to see this video. He will explain very clear how his journey of gene therapy was for him and his loved ones.
Yes. In fact, if I can interrupt there, Lotte, I've said this many, many times, but I really believe that Luke's film should be shown to all people involved in the gene therapy journey, whether it's the person considering having gene therapy or being eligible for gene therapy, and also their family members, and also all of the healthcare professionals around that person as well. It's such a useful and insightful film.
I agree. So this is, it's only 3 minutes, so take your time to look at it at home after this webinar. Another thing that we didn't want to reinvent is the idea of a model on psychosocial care. There are different models, but one of the, I think, easy to understand models, but very clearly explained, is the model of the cancer for pediatric traumatic stress. It's about the fact that most people with a chronic disease or acute disease are okay and do have sufficient care by a universal way of providing care. So it's psychoeducation, family-centered support, and it's needed to screen if all these families are okay. And we know that there is a targeted group, around 30 or 40%, who need more targeted care. So they need social work, they need maybe group sessions or help from a professional. And then there is around 10% who need psychological clinical treatment. And it's very important, if you have your patient in a room, to identify what kind of psychosocial need does this patient have, or the parent, or the children, or the partner? And especially in around new therapies as gene therapy, it's very important to have a clear overview of what this patient needs and where are the parts that make him anxious or depressed or insecure. So what we did, or what we did before in Amsterdam, was we used this model to explain how the psychosocial care in Amsterdam is organized. So we have this universal care in the blue. It's monitoring, screening, psychoeducation. Then we have more targeted care, and we have individual care in the last 10%. And this is published as well. So if you're interested in how you can organize, or also when you do provide a lot of psychosocial care, your center, it was very interesting to have like an idea or model where you can put the things you do in to organize. But what we did for the European Psychosocial Roundtable is to use this model. And we choose to have tires in green, yellow, and red. And so what is the multidisciplinary team doing from a broader view? That's preventing psychosocial problems, preventing medical-related stress, and supporting patients and families, and to increase or to keep the quality of life as high as possible. And the multidisciplinary team in hemophilia bleeding disorders, but also mainly around gene therapy, is involving, of course, the medical team. Then it's the physiotherapists, it's the nurses, or sometimes care surrounded the home situation. And, well, not that often, but it should be maybe more a psychologist or social worker. And if you think about the question for patients, do you want to have gene therapy? It's a hard decision to make. And a lot of different opinions is what the patient is facing. Opinion from the partner, opinion from the medical team. Maybe the patient want to read scientific literature, or reads on the internet, on blogs or forums about the cons and pros and cons of the treatment. And is maybe thinking about the future, about the children, having children, or the influence on children. If you look at decision making and shared decision making, it can be, you can separate a few steps. And it's very important. The first one is called team talk. It's very important to have the professional informing the patients that there is a choice. He can say, he or she, but it's mostly he in this case, can say, no, I don't, I want to have a choice, and I want to think about it. So this is a first. I think a lot of patients don't really realize that they're not in gene therapy only, but a lot of therapies, a lot of options, that there is a choice. The next step is to explain our options with the pros and cons of the different treatments, and the pros and cons of gene therapy or not doing the therapy, and to explain all these advantages and disadvantages. And it's also important to know for the patient if he is eligible or not for this gene therapy, and when does he know, and where does that is depending on. And then you can talk about preferences. So what are the goals? What is important in his life? How does this influence maybe things he loves to do, want to do, and where? So this is to get a clear overview of the patient's life from a holistic point of view. And then we have this irreversible decision. The gene therapy is something you decide at some point, and you have to make a decision. And you can only make that decision if you are sure that the patient has integrated all the knowledge, all the opinions, all the preferences together, and to decide yes or no to go for gene therapy. If we have this pyramid, we put it into another model we created ourselves. If you see the phases of the treatment, you have pre, during, and post. And you can have psychosocial care for the patient. Pediatric patients is not the case yet, but for the patient, the partner, the children, maybe the parents or extended family. And we can say on all this level for all the different groups of people what they need on all the 3 levels of the tire. So we started our roundtable by asking what's important pre-treatment. Then we asked what's important during. We ended with what's important post. And we mainly focused on the patients, this roundtable, because we could feel like there was a whole day meeting. We could have spent, I think we needed more than a week to do the rest as well. And we used WooClap, so we asked people what's important pre, and then people say it's about motivation, about understanding the information, expectations, are they realistic? It's about the impact on the patient life. It's about the journey. It's a lot of these themes, but especially expectations was one of the biggest things to be concerned about and need psychosocial professionals as well. And during, it was more about coping with uncertainty, coping with the treatment, coping with anxiety. There was a really need for support. I think there was a lot of about what's adjusting to the situation. And these were the things, well, you can read it, but the bigger the word, the more often it was mentioned. And post, it was again about expectations. It was also about maybe disappointment, but also support to adherence. It was about identity or maybe identity loss, about fear, about, and I think the expectations here were more like, did it fulfill the expectations they had beforehand? So what we are doing now is we will write a paper and publish, hopefully, on the model. We will publish a paper on the outcomes of the roundtable. And next year, we will building the principles and building the standards of care around new therapies based on what all the experts, all the people, all the patients in the room told us. And we will try our very best to create good standards of care for new therapies. Thank you. Back to you, Christina.
Thank you. And thank you, Lotte. And I would like to say a particular thank you to Lotte for all of the hard work on that presentation, but also all of the work at our European Roundtable earlier this year, which then garnered all of that fantastic information. So thank you, and that we will report back to you on the outcomes of our principles, which hopefully will be launched next year. So now myself and my lovely colleague Gráinne are going to speak briefly with you about the Allied Health Professionals Day, which will take place in Milan at the EAHAD 2025 Congress. So I'm going to speak to you briefly about the joint session. If any of you have attended before, hopefully you will agree that it is becoming more and more effective and useful in sharing knowledge with each other, not just us as psychosocial professionals, but in sharing knowledge and learning from each other, from the nurses and from the physiotherapists. Because one thing that I think last year or earlier this year was a fantastic joint session, which proved that we don't work in silo. It's so important for us to understand the issues that the other disciplines may be having. And for instance, a topic we discussed earlier was around needle phobia, and it was very interesting to learn some of the views and experiences of the nurses. It's not just a psychosocial issue, and it impacts us all. And so we're hoping to recreate the excellence of the content for this upcoming Congress. And as you can see, you've got the program there with the opening message from Flora Pivandi, and then an introduction from Paul McLaughlin, who is from the Physiotherapists Committee, Mary Kavanagh, who is from the Nursing Committee, myself from the Psychosocial Committee, and then we have also another colleague joining us. The topics will be very comprehensive. It is really bleeding disorders through life. You can't get anything more comprehensive than that. I can't talk about the studies that Mary or my other colleague, I can't see, there's an arrow across her name, fully their presentations. But what I can say for my own presentation is that menopause is a very not recognized difficult situation for women with bleeding disorders. I think sadly most people feel that when you reach menopause, perhaps your bleeding disorder issues might be over, and in fact they may have just started in some cases, or certainly become exacerbated. And then also, obviously, as it's a journey through life, with Mary's presentation, a young patient with severe factor IX deficiency and comorbidities, and then a case study on care homes, will give us a snapshot and show us, as the three committees, how our work interacts with each other in supporting patients through those life journeys. So that will be a very exciting joint session, and please do come and join us there. And I'll hand over to Gráinne now to talk about the main AHP Day.
Thank you. I guess to echo Christina, it is such a wonderful opportunity to learn and share experiences with the wider MDT. And I think then once we've finished our joint session, we come together as a psychosocial group. And what I have found particularly interesting in ones I've attended is just that learning about different models of care across Europe and how people work, and really that sharing of good practice. And to start our Psychosocial Day, we will have a fantastic workshop on ethics, which will be a really interesting opportunity to share those experiences from different countries and from different professions on how we problem solve, how we reflect, and how we come together to kind of share experiences, particularly as the world of haemophilia is such a changing landscape. There's a lot of new considerations for us to consider as psychosocial experts within the team. And I think that's going to be a really fantastic session with people from different places bringing different perspectives, which will be our first section, and we'll workshop kind of sharing experiences. And then we'll have a bit of a coffee break, and we'll move into our next session 2, which is where we're focusing a little bit more on traumatic experiences in haemophilia, where myself as a psychologist and Gloria as a social worker will give a little introduction following Karolien's introduction, a little introduction on some of the current issues that could be acting as psychosocial barriers as we consider changing treatments, as we consider gene therapy, as we're considering all these new areas within the area we work in. And some people may be aware of Anna Wells' work, which has been some really interesting research as a physiotherapist that she has been doing, looking specifically at trauma and pain memories for people with inherited bleeding disorders. In this, she has interviewed people with haemophilia and inherited bleeding disorders. She has interviewed healthcare professionals, done some really nice qualitative research, and has pulled those themes together. So that would be really exciting to hear where she's got to and get an update on her research. And then finally, we will have a little bit of a session on EMDR, and EMDR more specifically for people with inherited bleeding disorders. And again, that we have people from different countries and different experiences. And then finally, and possibly most importantly, even more opportunity for networking. And I think that is really such a benefit of the day, is coming together as professionals from across Europe, meeting, sharing experiences and networking as we kind of hear a bit of an update from the physios work stream, from the nurses work stream, and from the psychosocial work stream. So hopefully we will get to see some more people at it, where we can kind of come together and collaborate. But really interesting program this year, so I'm quite excited.
Yeah, so thank you, Gráinne. And I just want to add to that, this year at the Congress, for the first time, the Allied Health Professional Committees were able to give a short recap at the beginning of the main Congress to all the attendees at the main Congress about what had been carried out, what had been discussed during the Allied Health Professional Day and the joint session. And again, we will be doing the same this year. And I'm sure everybody will agree that what was fantastic was that the psychosocial element of the allied health professional work is now really beginning to be recognized. And it was a big topic of discussion during the main Congress, and hopefully with our recap of what will be a fantastic Allied Health Professional Day, will continue to promote the work that we are all doing across Europe and all the collaborating that we are doing as well, which is so important, and the learning from each other and the 3 disciplines. Thank you. So don't forget to register for the Allied Health Professionals Day, and obviously there's an email for contacting EAHAD, but also if you need to have any insight or help from us, do please reach out to us as the committee as well. Thank you. And now I'm going to hand over to our lovely colleague Petra from the Czech Republic.
Thank you for my word. Now I would like to speak a little about sharing experience. As we all know, hemophilia is a rare disease that's manifested by blood clotting disorder. And that's why patients often suffer from bleeding and acute and chronic pain. And treatment is usually associated with injections, and this brings specific kinds of stress and problems that have impact on patients and their families. So as we heard, EAHAD is a platform where people of different specialties can share their knowledge, and EAHAD Psychosocial Committee brings together healthcare professionals who provide psychosocial support and have practical experience with these specific difficulties and stress that life with hemophilia brings to patients and their families. So we wish to create a place where we can pass and develop our experience even more. That's why we think about future plans. I ask for next slide, please. So we were wondering about 2 ways how to cooperate more, or how to develop even more our cooperation. We were wondering about creating workshops, and I have a list of repeating topics that are usually addressed by psychologists and psychosocial workers, which is of course often pain management, because patients deal with acute and chronic pain, also transiting from pediatric to adult care, because it's a time when patients usually decrease their cooperation with doctors and with adult caring staff. Also, post-traumatic stress disorder problems, treatment. We often deal with anxiety, panic attacks, depression, or needle phobia, which we have to address, and we can share the way how to do that. We also can speak about motivating of patients, because it's a very frequent topic, to activating them, especially to support them to exercise and to contact each other. It's a big deal for people who are alone and separated. We also often address ethical problems, and we can cooperate with case studies. So we are trying to develop a possibility to cooperate more, and to share the knowledge with psychosocial specialists and to other specialists. We were also considering the possibility of conducting joint research, and this requires the selection of adaptation of uniform methods and procedures that help to get the knowledge, get this information on a national level and to share it on international level. So we invite all colleagues and co-workers who are interested in our program and in our activities to join us and cooperate with us. Thank you.
Thank you very much, Petra. Speak on her behalf. And we're very sorry not to have Gloria with us. As I say, she is a social worker at St. James's Hospital in Dublin and has been fantastic in contributing to all of our work. How to get involved in the committee? Please sign up for the Psychosocial Professionals Network. I have already this week been contacted by some of my colleagues in the UK who really would like to get involved. And we aim to connect colleagues working in the specialised area of haemophilia and bleeding disorders. We would love to build relationships, collaborations, develop a pool of experts. For instance, as Gráinne was mentioning, Anna Wells, to be able to collaborate with our physio colleagues and our nurse colleagues can only strengthen the impact of the work that we as psychosocial professionals carry out, and to raise the level of care for the benefit of all patients across Europe. So please do sign up for the Psychosocial Professionals Network. It will be, hopefully, as we go forward, a much greater platform for you to be able to access information and networking opportunities across Europe. Thank you. Next slide. And then again, importantly, as Petra was mentioning about research, and I can say this obviously with all of the work that Lotte does, who's very, very involved in research, is absolutely essential in moving forward the care, whether psychosocially or medically, for bleeding disorders, for any disorder or any health issue. And so we absolutely encourage research, and therefore there are research grants available. So applicants must be working in the field of inherited and acquired bleeding disorders in Europe, and you may seek external funding in addition to funding provided by EAHAD, but the support provided from other sources, including industry, should be disclosed in the application. And grants will be available exclusively for allied health professionals in 2025, and there will be a full announcement during the EAHAD 2025 Congress in Milan, Italy. So please seize this unique opportunity to support your professional development and innovation in healthcare, because we can all learn, all of us, from all of the research, the wonderful research that is carried out, and the benefit it brings to the bleeding disorder community as a whole. Thank you. So we go to all of us here now. I think we are really left with any questions from anybody who's been attending the webinar. To ask if any of you have any questions for us individually or as a committee, or any points of discussion you would like to raise.
And you can put it in the chat, I also think, Christina?
Yes, so let's have a look and see. No, at the moment we have nothing in chat. You can put it in chat or in Q&A.
Mm-hmm.
I would just like to ask my colleagues what you have found the most motivating element of being part of this committee. I'm going to start with Lotte because you are the founding member. Without you, there would not have been a working group or a committee. What motivated you to want to propose this to EAHAD, who so kindly have supported us from the very beginning?
Well, it's not an easy question. I think we started here in Amsterdam with a more broadly view of psychosocial or a multidisciplinary team with us being involved. And I think it was already quite a long time ago that it started, including psychologists and social workers. And then at the EAHAD meetings, I realized it was not everywhere in Europe the case. And then I thought, well, it is very important. And I'm not only working in hemophilia, but also in other diseases. And it was maybe better organized in some other committee, like organizations. And I thought it's lacking. So, and I think Anna, who is not with us anymore, was also very, very motivated to get psychosocial care on the agenda of EAHAD. And we just started. And then I got motivated by the fact that I think there was a black spot and we could do something. And I got motivated by meeting all of you, all people who want to do some extra for this patient group. And yeah, I'm still very motivated. And I think there's work to do, especially around the new therapies and around some other populations with bleeding disorders, such as a woman, for example, where we can really do things we are good at.
Yes. Thank you, Lotte, very much. Petra, I'm going to go to you now.
Thank you, Christina. I would say that originally I was invited, so it was for me it was some kind of I was curious, and I also like cooperate a lot. So for me, I would like to say what I get from EAHAD, and I get a great inspiration, and I learn about work in different countries and from different colleagues. And for me personally, it's very important. I was motivated, or I even got information about new way how to deal with big problems like EMDR technique. And I went through the training, and I must say it changed my professional life or professional way how I work. So it gave me a lot of experience and motivation, and I got a lot, and I hope my patients got a lot as well in this way. So thank you.
Thank you, Petra. I'm going to go to Karolien next, from the perspective of being a social worker and, for us as the committee, really appreciating how important it is to have your insight and input into the work we do. But how has it been for you?
To start with the beginning, it was my colleague, psychologist Karen, who was in the committee. And then she stopped working here in our hospital for hemophilia patients. So, she asked me, maybe you would join. And I'm very happy I'm in the committee now, because hemophilia is such a specific disease. And I know here in Belgium, lots of my colleagues, they are working with children or adults with oncology problems. And mostly it's oncology and hematology in one big thing where you work for. But there's so much to know about hemophilia that I was very pleased there was a working group and other people who are specialized in this disease, because there's so much to know, so much to learn about it. So this was a great opportunity to learn more about it and to get other information and experience from colleagues, social workers, and psychologists. And it's, yeah, most of the time, the doctors, the nurses, the physiotherapists are very important. But also here in the hospital, we have to stand for how important psychosocial care is. So social workers, there are lots of, the impact is very big on patients, and you need psychologists to cope with this and to talk about it, and the social worker, to most of the time arrange practical things and to talk about what is the effect on your work, what's the effect on your house, maybe where do you live, how much do you earn, can you pay everything, can you, all those things. It's very essential. I think there is a social worker and a psychologist committee for hemophilia patients and other disorders.
Thank you very much, Karolien. And I'm going to go to Gaby next. Please, could you tell us what your motivation was, Gaby? Hopefully he can hear me. Gaby, we'll come back to you. I'm going to go to you, Gráinne.
Oh, perfect. Yeah, probably similar to what others said. I think when I started in the area, you don't necessarily come across people that work into inherited bleeding disorders. So joining this kind of network, it gives you access to people with experience in working in quite a unique area, and that sharing of kind of continuing to develop your own practice in a specialist area has been really, really valuable for me, and hearing other people's experiences of how to have best practice and how to improve and share best learning has probably been what I've really appreciated, having gone along to the EAHAD study days or EAHAD conference and meeting others, but also then joining the conference and having a bit of an insight into saying actually what would be helpful to share with others, and how do we develop psychosocial care to bring it up to equitable access, which not everybody has. So really inspired by people's determination, but also gaining so much just from people's experiences and other people's learning and recommendations. It's been wonderful.
Thank you, Gráinne. It's been great to have you with us. Gaby, are you there now?
Yes.
Good, wonderful, Gaby. So would you be able to tell us your motivation for being on the committee?
When I started to work in the Hemophilia Center and Bleeding Disorder Center, I was already experienced medical psychologist and clinical psychologist, but when I joined this area, I didn't know anything about it. So no one in my country, there is only one center, and there was no psychologist before me. And there was a social worker that we cooperated a lot. We worked together a lot. We were running support groups and so on. But we had to invent our model. No one could teach me or give me his practice, his experience, what to do. And I think my motivation to join the committee and the EAHAD was to help other people not to be in this situation. It means to meet other colleagues, to learn from them, to help them, to teach them, and to build models together. So if someone in Belgium or in Norway or whatever is starting to work in the bleeding disorders or hemophilia center, you will have a model, and you will have colleagues to be advised by, and to talk to, someone to talk to, and to work with.
Yeah, no, that's very true, Gaby. And again, it's been fantastic to have you with us. From my perspective, I remember coming along at the beginning of 2018 to the Congress and being completely inspired by coming to the psychosocial. It wasn't even really a working group at that point. I'm desperately wanting to be a part of it. I come from a slightly different route from everybody else on the committee, in that my charity works with haemophilia centres. We are at 6 haemophilia centres in the UK, providing psychological support to their patients. But one of the things that really greatly motivated me was in my role formerly, where I was head of services at the UK Haemophilia Society, having trained many, many years ago as a counsellor, to realise the absolute lack of enough psychological support for the bleeding disorder community, certainly in the UK, as Gráinne will know. And my HBDCA and HPA, the Psychologists Association in the UK, we work and collaborate, and they do absolutely fantastic work. But there's just not enough across Europe. Not enough psychological support, not enough psychologists, not enough social workers, and all of us, I think, realize, and that was my motivation, that we hopefully would be able to influence not only the provision of really, really high quality psychological and psychosocial care, but also the access to it. And that's why we carried out our very first survey to try and establish what the existence was across Europe of provision. And we're still working towards improving that access and improving added psychologists to come into this field. And I think that that will be some of our work going forward, to enable people who perhaps psychologists who haven't worked, or social workers who haven't worked in bleeding disorders, to perhaps decide that they would like to come in, so that we can increase the number of people working in this discipline and in this absolutely incredible community of bleeding disorders. So that was really my motivation. Been very, very interested in working with people with inhibitors. And although obviously with haemophilia A, for instance, the treatment, since emicizumab Hemlibra has improved immensely, but there are still challenges which hopefully will be reduced soon for those with haemophilia B. So that's still, a lot of ongoing work. As was mentioned, Lotte mentioned, women with bleeding disorders, but also women, but also men as well, who have ultra rare disorders, because that is an area that is only now beginning to be kind of not necessarily recognized, but diagnosis is getting better. So more people are coming into this community with ultra rare disorders, and those ultra rare disorders can create a huge amount of isolation. If you're the only person that you've ever met in your entire life, there's no one else the same as you, that can be very, very isolating, no matter how supportive your family members are, your haemophilia centre is. So ultra rare disorders is also an area of great interest for us as the committee. And then obviously with Lotte's fantastic presentation about our work around the principles of psychology in novel therapies, there is so much still that is unknown, although wonderful with the new treatments for those people undergoing it, and also for their family members and even the healthcare professionals providing it. There is still an element of unknown. And also, I do think that we need to recognize as well those people who are not eligible, who would like to be eligible for novel therapies, and how that will impact on their psychological well-being. So we as the committee have carried out a lot of work, which I think hopefully we should all be proud of, in promoting psychological and psychosocial care across Europe. But we also know that there is still an awful lot of work to be carried out. But I am absolutely 100% certain that with our commitment and passion for what we do as a committee, and hopefully for you as the network and maybe new network members, that we can carry out this work to a really, really high standard, and therefore benefit the bleeding disorder community across Europe. And I wanted to add one final thing, and then I will ask everybody else if there's anything else that they would like to close with. But I should have mentioned at the beginning that we, as the Psychosocial Committee, at the next Congress are going to dedicate our psychosocial stream to our dear colleague Anna. She was such a wonderful psychologist, and she was very, very much loved and respected in her community, but by all of us. And we learned so much from her, and we will ensure that that work is continued through the committee.
And I
Christina,
see, Christina,
There's a question here. Yeah, in the Q&A. For some reason, I can't see it. Can somebody read that question to me?
It's
I
not really
will.
a question. Yeah.
No, it's not a question. It says it's answered, but I think it's very nice comment. It's an occupational therapist says, I seem to fall between the physiotherapy and psychology, so I'm really pleased to benefit from both groups. Last year at EAHAD, I attended the psychosocial stream and reinforced the need and benefit from MDT working and sharing experience. Thank you. It's not a question, but it's important to understand the physical and psychosocial elements. And we, of course, are very happy and agree on us. Oh, Gráinne already comment. Thank you. Yeah.
I actually want to say that many years ago, I worked for the worked at the Royal College of Occupational Therapists in the UK. And so it's very wonderful to hear from an occupational therapist, because I knew then and worked very closely with the mental health lead for that college and the wonderful work that they were doing there. So that's really, really fantastic. Thank you very much. So I'm just going to go around. If there are no more questions or comments, I'm just going to ask my colleagues if you have anything else final to add before we close the webinar in 2 minutes.
Maybe one little thing. I don't think there's mentioned the date of the Congress. So maybe it's nice to know that it's on the Tuesday, 4th of February, 2025.
That's brilliant. Thank you, Karolien. Thank you very, very much indeed. And also, I would like to add a thank you to the EAHAD team, Giuliana, Diana, and Angelos, who support us so ably and enable us to do this work, and the Executive Committee, again, for recognising the need for this committee and the importance of our work. But mostly, thank you to all of the people who have attended. And we hope, as our committee, that you have found this first webinar useful, helpful, and, as Petra said, inspiring. We were inspired, and we hope that you will be inspired to want to join us and to be involved and to collaborate in our work. So we will say goodbye. So goodbye from us all, from myself, Christina, goodbye from Gráinne, goodbye from Petra, from Karolien, from Gaby, we can't see you, but we know you're waving, and from Lotte.